I'm Marcus and I work at Privitar. I'll do some proper introductions in just a second. I'm going to talk about the process by which organizations that hold health data can make decisions about whether or not to share it. And one of the questions that came up in the chat during the previous presentation was exactly about this. Like, what is the data governance process that will allow people developing AI to do that on a solid base, on the basis of data that has been sourced and obtained in a responsible way. So I'll start with some introductions and then I'll dive into some findings from research that we did at Privitar about this process. So I work at Privitar, as Kasia was saying, and Privitar is a data privacy company. So we build a software platform that others use in order to de-identify personal data when using it for analysis. And most of our clients operate either in the financial services or in the healthcare sector. And one of the commonalities of those two sectors is that they are highly regulated and are often dealing with very sensitive data. And as Kasia said as well, I'm Marcus, and my role at Privitar is in our research and public policy team. So I'm really focused on the legal and regulatory landscape around data use. So a little bit of background and some context. I think everyone on this call would agree that sharing health data has benefits and that has been the case well before the current pandemic, but that COVID has definitely put a new spotlight onto the ways in which we can share and use data. And there are lots of examples of initiatives to try and boost this. So thinking of the Goldacre Review or the NHS's data strategy. But data is also tightly regulated and comes with significant risk for organizations. So that may be around compliance, it may be around reputation, and the media furore around the recent initiatives to share GP data for planning and research have really shown how important it is for organizations to get these sorts of decisions right. And we've also been seeing that often there are lots of organizations that hold health data but are hesitant about sharing it because they're unclear about what exactly they can share, under what circumstances, and with what controls in place. And although the law and regulation does provide some guidance, often that's pitched at the level of general principles. So the law will say things like, you should take appropriate safeguards, or you should apply appropriate security measures. And it's sometimes difficult for organizations to translate this principle of, what is appropriate into something that's actionable in a specific context. And there are various approaches to resolving this. So the one set of approaches is technical. So the Open Safety Project, which is a secure analytics platform. But we think at Privitar that data governance processes and privacy-enhancing technologies are also essential to sharing data responsibly. So when we started this research, which was almost 2 years ago now, we were trying to look at what best practice for sharing health data with researchers was, and we were specifically focused on England. And we worked with several organizations, so 2 case study owners, the Cambridge University Hospitals Trust and the Centre for Epidemiology at the University of Manchester. And we looked at how they went about sharing data with researchers. We documented those as a set of case studies, and we reviewed them with experts and standards bodies like the National Data Guardian and others to make sure that what we were documenting was actually meeting their expectations as standard setters. And then we published a detailed report, including some analysis and comment, and I'll say a bit more about how you can get a copy of that. But what I'll do for the rest of the presentation is just talk you through some of our key findings and what we saw in practice. So a couple of key findings, and I have really struggled with this slide because it's been quite challenging to distill down the report, which is about 20,000 words, into 4 or 5 bullet points that I can share with you in a short presentation. So I'll do my best to kind of explain some of the context behind each of these as I go through. So the first one is the importance of making decisions based on precedent, and this is really key to accelerating the decision-making process. So making sure that decisions are consistent and that researchers are getting access to data as quickly as is possible. This has its own challenges, so it can be difficult to determine when a request is sufficiently similar to a previous one so that you can reuse a decision. But we've seen that the organizations we looked at all have some way of triaging requests so that something which is considered routine can go through a more or an accelerated process, and the resources to really assess and manage risk are focused on the highest risk requests for data. And this links back to what Margie was saying about, making sure that the processes are not too burdensome on the people trying to get access to data. We also saw that organizations use de-identification extensively. So this is the idea of transforming or applying controls to the data to reduce the risk that an individual could be identified within it. So pseudonymization and anonymization are examples of de-identification. They have specific legal context. So we tend to use the word de-identification as a more general idea. And we found that this really operated in two layers. So firstly, deciding which values are suitable for sharing, and then specific approaches to de-identification in response to a particular request. So for example, if a researcher is asking for dates of birth, but the organization thinks that those might be highly identifying, checking whether things like an age band or maybe a month and year of birth would be sufficient to achieve the purpose that the researcher is trying to achieve. The other thing we found is that making decisions about whether or not to share data involve lots of different actors, often at different levels. So to take an NHS example, the Cambridge University Hospitals Trust, they have their own internal research and development department, but also they refer back to NHS-wide bodies for advice on things like confidentiality or ethics. And there's a need to really coordinate the different stakeholders involved in those decisions, partly to sort of speed up the process as well. And then finally, real uncertainty around anonymization. So I mentioned anonymization earlier. It has a specific legal connotation, but there's often significant uncertainty about when data is actually anonymous. And I know the ICO is consulting on updated guidance on that at the moment. So bringing that together, what I wanted to do was just walk you through how that data sharing decision-making process works in practice. So what we found was that organizations would first identify data that was suitable for sharing. So they may collect data in the course of their routine activities, whether as part of an electronic patient record or from other research and studies that are being undertaken. And some of that data may be suitable for onward sharing with other researchers. And that might rely on things like, what the reasonable expectation of the patients was, whether there was notice, all those sorts of issues would flow into determining whether that data is actually suitable to be shared. A researcher would then present herself wanting to access the data, and there was often a stage of vetting that researcher, so asking the question, is that researcher actually eligible and qualified? And there are various ways to do this. Some organizations relied on external vetting processes like the accredited researcher scheme. Others had their own internal processes, so for example, like the NHS Research Passport. In some cases, the researcher would have access to a data preview, so helping them to understand what the data actually is, like what values does it contain, how is it structured, and in some cases being able to form limited queries on the data in order to build a cohort, to assess whether the data could actually be useful for the project that they were planning to undertake. The organization would then review their request, so the researcher would submit a formal request to access the data, and that would be reviewed. And I mentioned the idea of triage earlier, so requests which were considered high risk, maybe they were requesting an unusual linkage between different data sets or proposing to investigate certain very sensitive values, or potentially using new research methods, including things like AI or machine learning. And that may trigger a requirement for further review if those requests were considered high risk. If not, the data could then be provided or provisioned to the researcher, and maybe that would be in the form of giving them access to data on some kind of secure research environment, or in some cases, giving them a copy, an extract of data. And then there will be some kind of audit or follow-up controls to ensure that the researcher is only using the data for the purposes that were agreed when they made the request, and that they have done things like appropriately stored the data, deleted it when they were required to, and those sorts of things. So this is a very simplified sort of idealized process, which represents some of the stages that we saw organizations going through around data governance. And I'd be really keen to hear in the questions and in the discussion later about the extent to which I think many people on the call will work in this space, in the data governance, information governance space. It'd be interesting to hear the extent to which this matches or doesn't align with what you do within your own organizations. So just briefly on the next step. So I mentioned that this report is going to be published soon. Actually, it's not yet published, so we intend to put it up on our website. But I do have permission to send you all a copy. So DLF will follow up with an email to everyone on the call with a copy of the report attached as a PDF. And what we're doing next is really trying to take our findings to the community of people working on data governance issues, gather perspectives, hear feedback, and we will review and revise. So we really want this to be a living, iterative document. And we also want to continue adding to the library of case studies. So we've started with 2 initially, and we will continue to add case studies looking at different organizations which have different perspectives on these issues. So I'll stop there and open it up to questions.